Right now in the field of psychiatry, right now psychiatrists are being called upon to treat patients with much more severe levels of medical illness, and consequently also patients that are in different phases of care. So, and one of those phases is actually the palliative phase of care. Even though psychiatrists are routinely taught how to deal with and discuss issues in regards to suicide, in a number of our training programs and even post-residency, we're not taught how to talk with patients who are confronting very natural causes of death. Our interest in palliative psychotherapy came about because of our work with cancer patients, and we realized that we needed to address patients or give them treatment tools and modalities in all phases of care: active treatment, diagnosis, as well as those that are in the palliative phase. The real principle, if you will, or the idea behind palliative psychotherapy is really helping the patient maintain control, find meaning, and maintain hope and purpose in their life, even while facing an extremely harrowing condition. Although the concept or the terms are somewhat new, palliative psychotherapy is really based on, if you will, many of the core principles that all of us can think about in regards to psychotherapy. But in palliative psychotherapy, really what we're trying to talk about is the idea of therapists being able to be present and attend to a patient. Therapists also being able to invoke, if you will, a spirit of mindfulness in patients, and also therapists being able to help a patient construct a narrative that will help them find meaning and purpose as they continue down the cancer care continuum. Palliative psychotherapy, if you will, or psychiatrists directly addressing issues in the palliative phase of care, is a somewhat new, if you will, dynamic or paradigm. There are many people that have been looking at this, probably most notably William Breitbart and his existential group-based psychotherapy, and others have looked at palliative psychotherapy in the forms of dignity therapy and short-term life review. What we hope to have done here at the APA was to give our listeners an overview of, one, what are the central principles behind palliative psychotherapy, two, how can those principles actually be applied in a time-limited fashion over 8 sessions, and then three, also really, in a very practical standpoint, encourage other clinicians and get them thinking about actually practicing this brand of psychotherapy with their patients.